My name is Cathy Burton. I'm a consultant haematologist in Leeds. So my role in this audit is one of the co-clinical leads for non-Hodgkin's lymphoma. So with my collaborator, David Cutter, who represents clinical oncology, I represent haematology within this audit. An audit really involves an audit cycle in terms of gathering information. So for non-Hodgkin's lymphoma, we have a number of data sets, for example, HES, which is hospital episode statistics. So we're gathering data, the COSD data, looking at the diagnosis of non-Hodgkin's lymphoma, and then comparing that alongside guidelines, NICE guidance, and looking really at the delivery of cancer services across England and Wales, with the intention then of feeding back this information to both individual cancer services across England and Wales, but also providing information to NHS England and Wales in terms of how we're performing as two countries in terms of delivering cancer services for non-Hodgkin's lymphoma, and therefore giving direction where improvements can be made. And then completing the cycle is then analysing this data, the improvements in services that are occurring, what more work can be done. So really it's a continuous process, but the real strength of this particular audit for non-Hodgkin's lymphoma is making the data available early. So the ambition really is that on a sort of 3 to 4 monthly basis, there'll be data being analysed, feedback both to NHS England and to Wales and to cancer services, and therefore there's continuous improvement happening on a frequent basis. I think that's the key question really, and the real strength of this audit as well is all the clinical reference groups, the stakeholders that are involved. So obviously there's clinical experts, there's leads of cancer services, as I've said, but probably sort of more importantly is representation from charities, for example. So Lymphoma Action, Blood Cancer UK are involved in this. Therefore, there's sort of patient and public involvement within this. And then also sort of the delivery of services at a more national level, like HQIP, NHS England, so how we actually deliver this. And I think the key thing is which questions we need to ask. So the sort of process of this is there is an initial sort of scoping document, and there's 5 main indicators we look at that point, and then we're widening that out to 10 key indicators that we're saying are deliverable, that we're going to investigate and improve upon, and that everyone will be inputting into those. And the idea is that by early 2024, those 10 key indicators for NHL delivery in England and Wales will be clear to everyone, and that then the sort of audit cycle will then start from them in terms of delivering on those. And I think the really key thing for non-Hodgkin's lymphoma is what areas of lymphoma do we look at. And I think what I'm really pleased with this audit is that we have really widened this out. I think it's very easy, and it is important to look at the common lymphomas, so diffuse large B-cell lymphoma, follicular lymphoma, because they are the commonest lymphomas that we see in routine practice. But other lymphomas like T-cell lymphomas are very difficult to diagnose, are very difficult to treat. And actually what we are all really keen as part of this audit is that things like early diagnosis, better diagnosis, maybe classifying patients in a slightly different way, so allowing access to novel treatments, I think will be a really important part of this process. I think we can learn an awful lot from the other audits, so particularly ones like bowel cancer and lung cancer, particularly established, so we're learning from those. I think non-Hodgkin's lymphoma, it is a difficult entity to study, really. I think things like lung cancer, bowel cancer, maybe the public are more familiar with. Lots of people have heard of that type of cancer, haven't necessarily heard of lymphoma. There's so many different types of lymphoma. There's over 200. So I think it's taken a while maybe to have the clinical databases and the diagnostic information available. I think now we're in a very good position to have that. We have a more unifying approach really to hematological malignancies across England in terms of the genomic laboratory hubs. And I think the diagnosis and treatment of non-Hodgkin's lymphoma is more aligned, and I think that's why it's a perfect time to be doing this audit. I think the important thing is equity, isn't it? And I think, you know, we are aware that there's probably different approaches. Lymphoma is difficult to diagnose, so a lot of this we'd like to work with our primary care colleagues in terms of early referral to hospital. I think it is better classification and making sure all patients have access to the diagnostic procedures that they need in terms of making a diagnosis and then having the appropriate treatment. So I think that's the strength of this, really, is linking in with all the cancer services across England and Wales, looking at what's being done currently, where is best practice being done, how can we widen that out across the entire patch so that all patients are diagnosed and treated in the same way.